Thank you all for joining today. I do want to let you know going into this recording that it is recorded and it will be sent over on our monthly newsletter at in the beginning of December. So welcome again, everyone, to our Crucial Conversations. This month, we are so excited to have Sasha from ACCESS Reproductive Justice with us today. We think that in light of, the political landscape, but also with Roe v. Wade, before and afterwards, ACCESS Reproductive Justice is such an important program and organization in our community. And we are so proud to put them on the spotlight today and highlight the amazing work that they do for the women in our community. But before we get started, I would like to acknowledge a couple things in the atmosphere. First of all, this month is Native American History Month, Heritage Month, excuse me. So I do want to have an Ohlone acknowledgement. So I'll just go ahead and read. We wish to acknowledge that we are on unceded ancestral homeland of the Ramaytush Ohlone people. As the original stewards of this land, the Ramaytush Ohlone understood the interconnectedness of all things and honored this harmony with nature for millennia. We pay respect to the Ramaytush Ohlone's enduring commitment to Mother Earth, and we honor their legacy and the resilience of Indigenous communities everywhere. So it's Native American Heritage Month this month, but every day, 365 days a year, just want to give acknowledgement to the original stewards of this land. Also, today is Transgender Day of Remembrance. So I just want to take a moment of silence to all of the people that we have lost in fighting for justice for the transgender community. Thank you so much. So without further ado, I will get started with Sasha's biography and let her take over. Sasha Nachimau, can you please correct me on your last name? I apologize. Okay. She is the Healthline Relationships Director at ACCESS Reproductive Justice, California's only standalone abortion fund. Together with her team, Sasha coordinates support for people seeking abortion care in the state of California, regardless of their state of residence. Located in the Bay Area, Sasha loves hiking, eating seafood, and reading novels in her backyard. So without further ado, I'll hand it over to you, Sasha. Thank you so much.
Thank you, Andrea, and thank you everyone for being here today. I am Sasha Nokimo. I use she, her pronouns, and I am going to be chatting to you today about ACCESS Reproductive Justice. And yeah, I just wanted to start with a couple of caveats before sharing my screen. One is that I am totally happy to be interrupted with questions. So if while I'm presenting, you feel like coming off of mute and making questions or comments, really here for that. You don't have to save them until the end unless you would like to. That being said, I'm not the best at monitoring the chat while presenting. So if there are things in the chat, those questions or comments, I will probably hold off to getting to until the end. And I also just want to say I woke up a little sneezy today, so I may have to pause and sneeze or blow my nose. And thank you for your patience there. All right, let me go ahead and share my screen. All righty. Okay, can folks see my screen okay? Purple screen, perfect, thank you. All righty. Let me just move this little thing out of the way. All right, good morning, good afternoon from wherever you might be joining. I, again, am Sasha. I use she, her pronouns. I'm the Healthline Relationships Director at ACCESS Reproductive Justice. And today I'm going to be giving you a bit of an overview on the organization overall of ACCESS Reproductive Justice, and then much more specifically on our Healthline Department's work, and which is the work of mostly funding abortion. And then I'm really excited to get into questions and comments and collaborative ideas at the end as well. So plenty of time to check in and answer questions towards the end. But wanted to start by grounding us in Access's mission statement. So we remove barriers to sexual and reproductive health care and build the power of Californians to demand health, justice, and dignity. So we are a California-based statewide reproductive justice organization. Oh, I'm not able to, oh, here we go. Great. Alrighty. And so Access was founded 31 years ago in 1993 by clinic escorts who were witnessing additional barriers that pregnant people were facing in obtaining abortions. So they were doing clinic escorting, which if you're not familiar with what that is, it's usually meeting folks outside of clinics who have appointments at that clinic and escorting them through what's often protesters outside of the clinic and kind of accompany them safely and compassionately to their appointments. And so these escorts were really witnessing and hearing from the folks that they were supporting that there was a need for support before folks even reached, those clinic parking lots, right? And so they founded Access RJ to really be the gap or bridge the gap rather between the clinic and the person with the appointment. So all the things that they might need to actually make it to that appointment. Which we will dive further into soon. But we further our mission in 3 ways. These are our 3 departments. So our Helpline department on the left-hand side here is our direct service abortion funding work. That's what I'll be spending the bulk of today discussing. We also further our mission through outreach and education. So presentations like this, meeting community members out in the world, also through clinics, through schools, through other grassroots organizations, and really working to spread information and bust abortion stigma through that education. And then we also advance policy at the state level. So through the state of California, we're not working on national policy. We're really focused just on the state of California. And we kind of develop a policy advocacy agenda each year, and all of the bills that we support really have to be in alignment with our reproductive justice values, which I will talk more about now. Oops, sorry. I'm having a hard time knowing how to go to the next slide. There we go. Okay, sorry about that. All right, so yes, obviously reproductive justice is in our name. I've mentioned it a couple of times now, so really wanted to just pause and kind of share the definition that we use internally and kind of how we understand reproductive justice. Definitely want to give a shout out to Sister Song. This is their working definition that we just are also in alignment with. Sister Song is, if you're not familiar, a women of color led reproductive justice organization existing in the South. And they're very much leaders and champions in the reproductive justice space. So their definition, and the one that we also adhere to, is that reproductive justice is the human right to maintain bodily autonomy, have children or a child, not have children or a child, and parent those children in safe and sustainable communities. So I remember when I first heard this definition, it seemed like it was working at the macro level, right? You're not hearing the word abortion necessarily. It's not getting into like what these nitty-gritty healthcare that we might be accessing is, but really it's zooming out and saying the right to make those decisions, the right to have bodily autonomy, as well as like the environments in which we are making these decisions, be them safe and sustainable. So I really love that lens when thinking about what reproductive justice is. Okay, I know this is a lot of words on a slide, and I did also want to share that I'm happy to share these slides after the fact for folks. I'm not going to read this or go over everything, but what I think is nice about this is that it kind of really spells out the difference between reproductive health, reproductive rights, and reproductive justice. So while the 3 are, of course, intersecting, they are also distinct categories, right? So reproductive health is really focused on the healthcare, right? What is the actual healthcare that we're receiving that exists in kind of a more clinical setting? Reproductive rights exist more in a legal setting, right? So what are the laws, what's actually written in the legal framework of how we can access that reproductive health? And then reproductive justice, again, is kind of taking this more macro understanding of the 2. It is an intersectional and social justice focused lens, on bodily autonomy, on how accessing reproductive health is not necessarily equitable across social groups. I would be remiss if I did not name that reproductive justice was coined by Black women and has always been informed by BIPOC and low-income activists who really witnessed those inequities and knew that there needed to be a whole separate category in addition to reproductive health and reproductive rights. Alrighty, so that's kind of the framework and just some shared definitions that we're working with. And now I'll kind of dive a little bit more into the work of Access Reproductive Justice. So this is just a snapshot from our website. And so folks often find us through a couple different ways, and particularly our helpline. So as I mentioned, our helpline department is our direct services arm. Direct service being the service we have in direct connection to community members who need our support. So folks often find us through these ways over here on the right-hand side. We operate an English and Spanish helpline, so folks may call, reach out, leave voicemails, send text messages to that helpline. I do also want to note that we have staff who speak in English and Spanish, but we also are contracted with Al Boom, which is a really wonderful live translation organization. And so we can actually now connect with folks in over 100 languages to fill out intakes and create support. So we do have these two lines in English and Spanish, but we have capacity to communicate in many more languages, which is wonderful. We also have a support request form in which folks who have appointments or advocates can fill out this support request form. And of course, that's requesting support from us. And what's really wonderful about the form is that it will automatically create a partial intake in our system. So we are already almost like halfway towards being able to support someone because we already have so much information in our system that we can then go off and kind of begin support once we've connected, versus if folks just leave a voicemail, which is, perfectly fine, but it means we do need to still then go in and create a whole intake with them over the phone. That's definitely our preferred method. And then just want to call attention to the green circle here on the safety exit. Safety and security of our callers is absolutely paramount to us. And so having this ability for folks to just click it and then the window will automatically exit is important to us because we know that not everyone can safely be searching abortion access resources. All right. And so when folks reach out to us, what do we do and what do we offer? How do we do it? So this is more of the nitty-gritty of our helpline department. So we will support two groups of people, anyone with a reproductive or sexual health care appointment in California. So that's regardless of their state of residence. If someone has a reproductive or sexual health care appointment in the state of California, we can offer support to them. And then any Californian who has a reproductive or sexual health care appointment in another state. And so, yeah, if a Californian is leaving the state or is, living temporarily, right, they might be a student in another state, for example, we can also support them. So it just has to be someone with connection to the state of California, since we're a California-based organization. And we support with two types of care. So that's procedural support and practical support. Procedural support is funding towards the cost of one's appointment or procedure or pills that they might be taking home. So you'll notice that I, have kind of interchanged abortion care with reproductive or sexual health care. I do want to kind of just backtrack and name that. So we will support any reproductive or sexual health care appointment. That can be prenatal, it can be abortion, it can be birth control, STI testing, gender nonconforming and trans healthcare, right? Anything under that umbrella. And also the vast majority of those who call us have abortion care appointments. And so a lot of our care is tailored to those appointments. But again, that's not a requirement for receiving our support. So we could support with procedural support. So yeah, the cost of the actual appointment or procedure. And then practical support is kind of everything else. So as I mentioned in the beginning, like what's standing in the way of someone with an appointment accessing that appointment. And some of that looks like this. So I would say the top three categories that we're, receiving requests for is transportation, lodging, and childcare. But practical support can look like anything. So aftercare supplies might mean a gift card to Target to get pads, right? Or a heating pad, anything to kind of make recovery process more comfortable. Childcare funds for obviously folks who have children and need to pay someone to watch those children while they make it to their appointment, or who may need to travel with those children and thus might need to bring along a companion or a guardian to watch those children. Clinic escorts, kind of already talked about this at the beginning. Cremation or burial expenses for folks who want to maybe cremate or bury fetal remains. Doula and emotional support, I think it's kind of self-explanatory in terms of just offering emotional support during an appointment or an abortion process. Food and meal funds for folks who are, often traveling, they're outside of their home, they maybe can't cook, right? They need support with meals while they're away. Lodging for individuals who have to leave their community for healthcare appointments or who may not have access to safe and secure housing, right? So we can support in both instances. Lost wages. This is something that we've kind of just started offering, which is really wonderful. Folks who have to miss work for abortion care appointments and may not have paid leave, right? And so we are able to kind of compensate for the missed work that they had to be able to make their appointments. And then transportation in its many kinds, planes, trains, and automobiles, really, kind of anything that an individual might need. Again, we're supporting anyone who has, an appointment in California. And so some folks live in California and some folks live in other states. So really the transportation depends very much on where someone resides and where they have to travel to. Andrea, I'm seeing your hand. Go for it.
Thank you. I appreciate that you said we can ask questions throughout the presentation. So thank you for that. I saw a comment in the chat that asked if a part of your care includes undocumented people.
Yes, great question. Thank you for asking it. Yes, so I think I could have been a little more clear. We, like I said, support anyone with an appointment in California or any Californian leaving the state for care, but we are not asking for proof of residency. We're actually not asking for proof of any kind. So no proof of need, no proof of residency, no proof of age. We are asking, what's your zip code? And that, of course, helps us to know if you qualify, but we are not asking for documentation of any kind. So absolutely here to support those who may not have documents. Tracy.
How many offices do you guys have?
So we are a completely remote team.
Okay.
So we have a staff of, as of last month, we're a staff of 13 folks. We are in the middle of training 2 new folks, but yeah, we're a fully remote team and we're all based across the state of California.
Okay. And next, because I'm director of Sister Circle Women's Support Network, and we support women in the San Francisco community that are struggling with drug and alcohol, substance abuse, and other barriers that women face, and especially domestic violence. And so I'm glad to be on here today with you guys. To refer like one of our women to you guys, do we go to a website or is it a phone number?
Yeah, great question. And I have a whole site on that, and I will also follow up with just links so that you can kind of click them and bookmark them easily. But yes, the online form that advocates and people with appointments can both fill out, right? So if you want to fill out on behalf of someone you're working with, or if you want to, if they want to fill it out themselves, both work. That's definitely the best way because, as I said, it kind of fast tracks the process in our system. But if that's not an option, if someone doesn't have access to the internet or just prefer to leave a voicemail, send a call, we also have that phone number that they're welcome to call.
Great, thank you.
Yes, thank you for your question. Okay, great. I'm going to move on, but again, feel free to come off mute. And if you raise your hand, I can see that really easily on my presentation view as well. So yeah, I think that was basically all I was going to say in terms of the practical types of practical support. What I really love though about practical support is that it's emerging, right? And so whatever the emergent needs that folks have, we're often able to support with. And so it might shift, right? So we even just cremation support and lost wages, we were not able to offer that a couple years back. On the one hand, we didn't get a lot of requests for either, but our funding was also more limited. And so we have more funding, we have more capacity, and we've received more requests for these types of support. So we've been able to really adapt and now offer them. Okay, just a little bit about our impact. And so last fiscal year, we supported just under 2,000 folks, which is an all-time record of number of people supported. When I started in 2020, we supported just around 300. So we have really been able to scale up our support by hiring more staff and really streamlining processes. So we supported just under 2,000 folks last year, and we spent $650,000 on procedural support. So again, on appointment costs, and then 660,000 on practical support. So all of those logistical needs. And I do just want to mention that this funding capacity is really, really very much due to the state of California passing several items in its budget in 2022. I don't know if folks are familiar, but the Future of Abortion Council gathered California legislators and advocates to kind of suggest bills for the California legislator and governor to pass to expand reproductive access in the state. This was very much in direct preparation for whatever the Dobbs decision outcome was likely to be, knowing that it was likely to be unfavorable to abortion access, and of course it was. And so there were many wonderful things that came out of that. But one of them was, or a couple of them were advocating or allocating, excuse me, funds for practical support for abortion seekers, as well as procedural support that would go to clinics to help offset costs for abortion care appointments specifically. So ACCESS received lots of funding specifically for practical support. And as a result, we've been able to fully fund folks' practical support needs in a way that we simply just did not have capacity to do before this funding came across. So just want to, small aside, just really share that what a wonderful impact that's had, and that I'm still, like, I look at these numbers and I'm still really quite shocked at how much we've just been able to give back to the community through that funding. Okay, state of origin. This is also always really important for us at ACCESS to underscore, right? So 80% of our callers were Californian residents, and 20% came from out of state into the state of California for care. This is important for many reasons. I would say not least of which, I know that California is very privileged in our reproductive rights. We have, certainly in comparison to other states, we enjoy a lot more reproductive freedoms. And if there are still, so many folks reaching out to us, we know that abortion access is not equally accessible across social groups or across the state in general. And so it's really important for us to just uplift that, like, yes, California, as the governor has deemed it, a reproductive freedom state, sort of. And also there is a very real need from its residents for access to support to be able to make it to their appointments, to be able to afford their appointments. And so, yeah, that data point just feels really important for us to underscore. Okay, I wanted to take some time to talk about the ways that we address safety and privacy concerns of our callers, specifically for this audience, which I'm really just want to thank all of you in the DV and adjacent spaces for the work that you are doing. This is definitely, these are just some of the ways that we kind of are prioritizing caller safety and privacy. But I would also love to hear from you all about ways that we could improve this. So first and foremost, speaking with and centering the pregnant person or the person who has the appointment. So sometimes advocates or partners, family members, friends might reach out to us on behalf of someone with an appointment. And many of them are well-meaning, right? They're supporting, they're advocating for that person. And we can take those phone calls as a starting point, but we will not proceed with coordinating any support until we can really speak with the person who has the appointment. Again, as Andrea said at the beginning, this is kind of just keeping an eye out for reproductive coercion. We want to make sure that the person who has the appointment wants the appointment. And so by both being sure that we are speaking with them to do their intake, hear from them about when's your appointment, what is it you need, as well as, yes, just kind of centering them throughout the process. So there are some times where they may give us, let's say a partner's phone number to communicate with. That can certainly be fine, but we want to make sure if there's any like major shifts in the support process that the partner is advocating for, we're always going to double back and circle, check in with the person with the appointment to make sure that that's something that they are actually wanting. Next up, getting consent to leave messages and identify ourselves. So this is in the first couple of questions that we're asking either when someone's filling out a form or when we're on the phone with them creating an intake. Is it okay to leave a message, leave a voicemail, send a text message, as well as say who we are and why we're calling. So of course we want to really just get explicit consent to be able to leave messages candidly and be explicit about who we are and what we're supporting with. If that is not an option for folks, our go-to standard pseudonym is, hey, this is Jane, call me back, just super short, super to the point. And that's also in our voicemail message. So if someone's leaving a voicemail for the first time, the message that they're hearing from ACCESS is like, if you don't say it's okay to leave your name, someone named Jane will call you back. So that's also letting them know that if they hear Jane, hopefully they'll remember it's ACCESS, and we can kind of go from there. Okay, booking hotels with alias names through Safe Stays. So I'm not sure if anyone here is familiar with Safe Stays, but they are a super wonderful hotel booking platform. They were founded by advocates in the DV space. And so they also have just, privacy and safety really top of mind and baked into their whole process. So So Safe Stays makes relationships with hotels, and part of the hotels that they're making relationships with are hotels who will accept what they call alias names or fake names, right? And so when ACCESS is using Safe Stays to book a hotel, we can have the option to sort by alias names. And so this is just sorting hotels in an area who will not require an ID or a real name in order to book a hotel. So it will actually automatically generate a fake name in the platform, right? And so then we can tell the caller, your name is Jane Smith, or your hotel reservation is under, Jane Smith, and they will not need to have their present their ID at check-in. Of course, this is, a great safety concern. If someone calls a hotel looking for someone, asking for a guest, they're not gonna, not going to have the alias name. So this is just an added level of security for folks. Also great on Safe Stays is that if you want to use your ID and kind of your real name, that's totally an option as well. But Safe Stays just allows the option for alias. The other wonderful thing about Safe Stays is that part of their hotel relationship building is that they put their credit card down on file. So they're actually paying for the hotel reservations. And then at the end of the month, billing us for all of the month's stays. But that also means that guests don't have to present a credit card for a deposit at check-in. So again, just removing these layers of personalization in ways that folks can find guests who may not want to be found. All right, and then lastly, tapping into our volunteer network for rides, escorts, and emotional support. So we have a network of what we call PSVs, practical support volunteers. We have a wonderful dedicated staff member who is dedicated to the training and recruitment and onboarding of our volunteers. And so all volunteers do have to go through a reproductive justice 101 and vetting process with us before they're folded into our network. But we have volunteers who can provide rides in their own cars, check out folks from clinics, right? So that escorting process, as well as providing emotional support, which usually is a virtual support, right? So talking on the phone, texting, video calls, whatever someone might need, kind of remote emotional support. And this is really, wonderful for many reasons, but certainly for folks who might be experiencing reproductive coercion at home or in their family. And they may not have anyone to share who they feel comfortable sharing with or safe at all to share about their experience. They may not thus have a ride home from their appointment. Folks who receive anesthesia for abortion care appointments are not permitted to drive home. And so they do need to have a name and number of a clinic escort. And so if they don't have anyone, safe in their community to rely on for that ride, they can tap into our volunteer network for those rides. And yes, this is just another level of being able to maintain that bodily autonomy and not having to risk, revealing things that you don't feel safe or aren't able to reveal to those around you. Okay, and so abortion funds, just want to kind of touch on some of the ways that we are important in this space, right? And so we are uniquely powerful since we are so directly connected to community members and their needs. We are on the phone, we are texting with folks in the community every single day. And so we are really uniquely positioned to hear what our community needs. And I think that's just really one of our biggest strengths and why something I really love about ACCESS, that we have both our direct service as well as our policy, right? Because we are uniquely able to hear directly from community what they need and deliver that to our policymakers, right? Like folks need free abortions. And so we've been able to get reduced abortions at the state level. So we're uniquely positioned in that way. We're also really able to be nimble and adaptive to those needs. I know I touched on this earlier with we got more money and now we're able to offer lost wages, for example. Like we have a lot of flexibility to respond and react and expand to the needs of our community members as we're hearing it. I basically just said this, but yeah, pushing progress at the local, the regional, and the national level. So while we are California based, our policy advocacy person does occasionally have meetings in kind of a more national space and is able to kind of represent California and Californians across the state. And so that's also really kind of part of the overall policy changes. We are part of what's called the National Network of Abortion Funds. Again, I can put this info in an email when I follow up too. Their website's abortionfunds.org. Actually, I think I have it on the next slide. But the National Network of Abortion Funds is exactly what it sounds like. So it's a membership organization that funds can opt to be a part of. And there are over 100 abortion funds across the nation. And so we have access to folks doing this work in many different states, in all 50 states, I believe, actually. And so while the work looks different based on the state, we really can lean on one another to hear about what works there. How did you do this? And it's just a really supportive way of meeting the community needs and learning from one another. And then finally, yeah, ACCESS has been around since 1993. We have decades of expertise in this work. I hate to say that we're ready for the Dobbs decision and we're ready for this new election, but we really were. I mean, I hate to say it because I hate that we have to be ready and have to be prepared and have to be used to, facing that abortion access is really inequitable. But also we're proud of it too, right? This is something we've been doing for decades and we're here to help community members no matter what. Okay, so yeah, I just started touching on this, but these are some resources for abortion seekers. I would say also really wonderful to have as advocates for abortion seekers. And I'll just go over them super quickly. So let me hop into the time. Looks like I have another couple of minutes. of course, access reproductive justice in the top left. So as the language we use is California's only standalone abortion fund. And what that means is just that we are not attached to one particular clinic. So some clinics do have their own abortion funds and they will support patients at their clinics, right? But we are kind of a standalone abortion fund, as in we will support anyone going to any clinic in the state. Just going down on the left-hand side here, the National Abortion Federation is a national funding organization. I'm sorry, I don't have a QR code for them. I could not get that going in time. But their website is there, prochoice.org. The National Abortion Federation will only fund at their membership clinics, and so, which is on their website, but they will not fund at any clinic. They have a more kind of rigorous onboarding process for clinics that they'll support at. And they also do require that callers or patients be in a certain level of, I guess, of need, right? So they do have a proof of need requirement, and folks have to have a certain level of income. I don't know what it is, and they're not forthcoming about that, but they do have kind of stricter qualifications and eligibility requirements for receiving their support. I just mentioned this one, National Network of Abortion Funds. Again, really wonderful to see across the state how many funds there are. Every fund is different. Some are all volunteer run, some are staffed, some are small, some are big. Some support whole regions, and others are, just support one tiny corner of one state. So it's really wonderful to see the ways that the work can look different based on the fund and the region they serve. On the top right-hand corner, ineedanA.com. This is my new favorite website. As of like a year and a half, I'm on this almost every day. They are a national clinic database that is working really closely with abortion funds, really closely with independent clinics, and they are updating their information. It feels like constantly. I don't know exactly how often, but they really strive to keep their information up to date. And so folks can search their zip code and their weeks along that they might be in pregnancy. You can also select, I don't know how far along I am, and it will show you the clinics in your area. Not only that, it will also show you the local abortion fund that works at the clinics in your area. So it has tons of great information. Again, in such a big state as California, and since we support folks all over the state, I'm always on there kind of just checking in to see where the nearest clinic might be for a given patient or caller. All Options is a really wonderful judgment-free talk line, and they support folks across the pregnancy spectrum, right? So it says here their decisions, feelings, and experiences with pregnancy, parenting, abortion, and adoption. So they are really here to support folks in the full range of pregnancy-related experiences. And we have received many trainings from them over the years, and they're just such a wonderful, wonderful, unbiased group of folks that our team regularly refers folks who are, experiencing any kind of emotional experience. Really, it doesn't even have to be necessarily grief or, not knowing what sort of decision they might want to make, but kind of really the full range of experiences. We're regularly referring our callers to All Options. And then finally, Plan C Pills is kind of a wonderful database for abortion pills by mail, again, across the nation. So similarly to ineedanA, folks can search by their zip code. And Plan C Pills isn't a clinic, isn't a telemedication abortion provider itself, but rather a connection to all of the providers that offer pills by mail in one's community. Oh, sorry. Trying to get to the next page. Here we go. Okay, and then here is just some ways to get involved in Access Reproductive Justice's work. I'll follow up with these slides. We try to make the QR codes pretty easy in case folks want to volunteer, either as a practical support volunteer or an advocate. Of course, we always need donations, and right now we're in our kind of annual winter donation season. And actually, since y'all are based in, or at least some of you are based in the Bay Area, we will be having a really exciting fundraiser and drag show in Oakland in December. And I will follow up with that information as well, in case y'all want to come out and enjoy some drag and abortion access baddies in the space. And then finally, just our website and our helpline numbers in case folks want to learn more or refer their patients. I believe that's it. Yeah. Thank you all for listening to all this information. My email is here in case you have any questions. But yeah, I'll follow up with the slides, the fundraiser, and any other resources that I mentioned in here to Andrea. And then I'm sure, Andrea, if you're willing to send it out to folks, that would be great.
Yes, thank you so much. Does anybody have any questions for Sasha?
I do. What are the protocols for minors? Do any of you have any? What are they?
Yeah, great question. Overall, I would say the short answer is we support minors. We support anyone with a reproductive health care appointment in California. Certainly there are different considerations in terms of, let's say, leaving California or entering California, getting on planes. Like, there are different considerations and maybe different laws. But overall, we are able to support and do support minors. If you had like a particular instance or question you wanted to ask to get more specific, but I'm happy to answer it, but that's kind of the protocol.
Yeah, because sometimes some minors, like, they're in school, so that means that someone would have to take them out and they don't want their family to know or their parents to know, because sometimes they do call their parents so saying that they're absent. So it's just, what are those protocols in case a youth does need to get those services, but they don't want their parents to find out because they're absent in school?
Yes. So youth in California are legally permitted to leave for a healthcare appointment, leave school for a healthcare appointment during the middle of the day. It's not required that they inform their parents. That being said, of course, as you just named, like, that doesn't mean that every administrator is going to know that or know how to proceed. We do have some relationships with school counselors. Again, we support the whole state, so it's not like we don't have relationships with every school system. But yeah, as much as we can kind of confirm to school counselors and coordinate, we are often coordinating with school counselors to begin with. They're often making the referral, and then we might be connecting directly with the person with the appointment. But I also think this is a wonderful instance for volunteer drivers, right, who can pick folks up at school, bring them to their appointments, and maybe bring them back to school. So yeah, it does require more consideration, perhaps more creativity, but it's definitely something that we do regularly support.
Hey, good afternoon. I was curious to know, how do you protect people's data from, maybe attempts by nefarious actors to mine your organization for people's identity?
Great question. And we are in the middle of a kind of tightening up of our protocols literally this month. So I will say that we do have like a security guideline that everyone at the organization must adhere to, right? So we are using VPNs. We have two-factor authentication for every single system we're entering. We are regularly clearing our entire history and deleting everything off of our computer daily before we end our days. And we are in the middle of coming up with a system in which we're regularly actually deleting our caller data on a certain cadence. So we just made the change to a new system for all of our caller data literally last month. So we're in a new system, and so that's why we're able to really rebuild it to be what it needs, and that's why we're in the middle of coming up with a new cadence in which we're wiping all of our data. But we are definitely taking it very seriously. And one thing that's really great about technology is that there's so many ways, and I didn't realize this, but there's many ways to preserve data from a high level perspective without that personal information, right? So we can have information on how many callers were between the ages of 20 and 30, right? Versus this is this caller who's 21, and what those risks can have. So we're in the middle of securing that and more regularly wiping it.
Thank you. If I may, I have one other question.
Of course.
So you spoke to the need, the history and the roots of the term reproductive justice and the work of Sister Song to be focused on Black women and birthing people in particular. And I was curious if you could share some of your demographics, and I don't know if I missed this because I did join 10 minutes late, but just your demographics of who you're helping, the racial demographics, and then like if you have, or if you have like an outreach plan or visibility plan or a public education plan, knowing what the disparities are in community to potentially let BIPOC communities know that this resource exists.
Yes, yeah, thank you for that question. No, I did not put demographic info in the presentation. You didn't miss it, but I do know that the majority of our callers identify as BIPOC folks. And it's and it is, in fact, the vast majority. I'm actually not going to come up with, if I don't know it for sure, I'm not going to say it, but I know it's the majority of folks that identify as BIPOC. As well as young people, right? So the majority of folks are under 30 as well who call us. When it comes to the kind of outreach plan, I would say that I don't have a particular outreach plan myself because it's not my department, but yes, centering the folks who face the most reproductive health barriers is central to our mission. And we know that those are BIPOC folks, young folks, undocumented people, low income people. And so that's definitely part of our kind of central to making sure that that's, how we're accomplishing our mission. And in fact, that is why we capture that data. We've been having a lot of conversations about data and do we need it to support people and do we not? And one thing, and we are re-examining all of that, but one thing that's been really great about the data is that it helps us to know if we are in fact centering those who face the most reproductive healthcare barriers. So yes, while we're in the middle of kind of re-examining that, but the majority of our callers are those most impacted by reproductive healthcare barriers. Jude.
Hey, I just wanted to hop on and introduce myself and also just kind of start a conversation that I was hoping to eventually have with you all. So I work with the San Francisco Human Rights Commission, Civil Rights Division. Brittany Chiquata also is the Economic Rights Director. And part of why we wanted to hop on this call and hear more about your services is that we do some drafting of local legislation in the hopes of expanding civil rights. And we wanted to kind of start a conversation with abortion providers, abortion access providers, folks getting abortions under this new administration. What are the kind of legal protections you all will be looking for that our office might be able to try to help write, push along, et cetera. So we're really hoping to, it doesn't have to per se happen today, but like start that conversation on what can our office do as far as like local San Francisco ordinances, because we are at a San Francisco based office.
Amazing. Thank you for wanting to do that. Thank you for wanting to start the conversation. I think that my best response I could give is that I would love to connect you with our policy advocacy coordinator because it is all her domain.
That is awesome. I'm going to put my information in the chat as well. That I would love to start that conversation.
Thank you. That'd be great. I can follow up with an email.
Do we have any other questions?
And Andrea, I actually haven't been able to look at the chat. Was there anything in the chat that I could address if you wouldn't mind?
Yeah, I'm not necessarily seeing anything that we haven't discussed so far.
Okay, great. Thanks. Taylor.
I just wanted to thank you so much for joining us. I'm our youth coordinator, so I also just wanted to raise up that for those of us who are supporting youth who are going out of state for college or for educational opportunities, It's a really wonderful resource to be able to have, because I think a lot of the times young people find themselves in a new state or a situation where they don't know what their rights are. And so being able to direct them back to you regardless of where they've settled is a really wonderful thing to have. And then also just being a DV agency, I do want to raise that we know that the risk for domestic violence increases after a pregnancy has been confirmed. And that can continue the entire pregnancy and during the postpartum period, which is one of the reasons we love being able to provide people with options and places for safe and confidential discussions.
Thank you, Taylor. And yeah, I think additionally to the piece of folks who might be going out of state for studies or something else is also that national network of abortion funds too, because they might have a local fund in their area, and local funds are just always the experts at getting care in that community. So that could be a good resource to share with folks as well.
So what are ways that like organizations like ours, a domestic violence organization, can really advocate for survivors who are going through the needs for reproductive rights? Like, what can we do to further enhance the mission and like get this information across to people who don't know what rights they have? What would you like to see?
Yeah, I think it's really, I mean, I know it's sort of cliche and it's kind of baked into your question, but I think it's really just knowing what your options are, knowing what your resources are, knowing that there are things I guess I didn't touch about this. There's always kind of a lot that can, there's only so much that can fit in one presentation. But there's also, I'm thinking about the ways in which every insurance plan, there's an option to opt out of receiving healthcare that will show up on your statement of benefits. It's called a confidentiality communications form. And many folks don't know about that. I didn't know about that until I started this job, right? So it's not a perfect solution because you do have to fill out a form, send in the form, wait for that to process. But it is potentially an option for folks who, might be not able to, or it's not safe to have their reproductive health care appointment appear on their statement of benefits. So that's one option to know about. And then, yeah, I think just knowing that there's ACCESS Reproductive Justice here in California. There are also other reproductive health and adjacent organizations that might be able to bridge the gap between, needing an appointment and actually really getting that appointment. And yeah, I guess I didn't put this on there, but there's also abortion.ca.gov, which is a state-run abortion access organization website that's full of kind of California specific resources. And so it also has a lot on legality, both for California residents and those traveling in. So I think just the more information we can get out about what's legal, what's safe, what's possible for really anyone is really just the first step.
Do we have any other questions? I guess like with the few minutes of time that I have, and I know that we've previously discussed personal 101 about, the current politics of everything, but in your opinion, just for the audience, like, do you foresee a greater need for services, and for people who are like outside of the state, can they like coming into California for that, like how it works? Kind of a
Yes. Yeah, I mean, I would say yes, we foresee and are preparing for an increased need from out-of-state folks traveling into the state of California. The 3 states that we receive the most requests for support from are Texas, Arizona, and Nevada. Fortunately, Arizona just in this past election voted to expand their care. So they were previously had a 15-week ban, and now they have what we call a viability ban, so usually around 24 weeks. So that has certainly will expand care in the state. So there's, in some ways, there are positive things, and maybe that will be fewer folks from Arizona may have to leave. But of course, we're seeing, every state is really is of course voting on their own thing. And so, Florida recently, with their ban going back into effect, we have started to see more callers all the way coming from Florida, which is just, it's infuriating, right? Florida is not close to California, and nobody should have to fly across the whole entire country for healthcare. And we are prepared and we're willing to support. And so, yeah, I think we will see more and more folks coming from out of state in the coming years is our prediction.
Gotcha. Well, if there's no other questions, I would like to sincerely thank you so much, Sasha, for giving us more resources to advocate for the people in our community, for the women and gender non-conforming for our community. So thank you so much. And thank you all for joining and for your questions and being so insightful. This is a great conversation. So thank you so much.
Thank you all for being here. I really appreciate it.
All right, I will let you all get back to your day, and do not worry, I will share this information and also about the fundraiser as well. So thank you so much. Take care.
Thank you guys. I appreciate you.
Thank you.
Appreciate you.
Thanks. Bye.